following program contains the opinions of its host and guests, not those of this network. The opinions expressed are for non-commercial informational purposes only. Listeners are cautioned not to rely on program content to treat or prevent disease, but are advised to consult with a licensed healthcare professional where they live for diagnosis and treatment of disease.
And now, the superstar of alternative health and purveyor of medical truth, Dr. Joel Wallach.
Hello and welcome to Dead Doctors Don't Lie. Dr. Joel Wallach, your host, a veterinarian and physician. And I'm here for kids and baby boomers and seniors who don't want to die at 75.5 like their parents and grandparents. I'm here for kids and baby boomers and seniors who don't want to be sick and miserable for the last 15 to 20 years of their life like their parents and grandparents. I am a conservative. A lot of people say I treat them like dogs, but they do seem to get better. Now, if you have a personal health challenge you want to ask about, if you have a health challenge of a friend, a loved one, a workmate, or if you want to talk about medical politics or the home-based business opportunity, give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. Well, again, I want to go back and fall back on clinical epigenetics. Of course, my book, best-selling New York Times, best-selling Amazon, Epigenetics, The Death of the Genetic Theory of Disease Transmission. I want everybody to get that book. It covers the same 900 different diseases that Dead Doctors Don't Lie, the original book, actually talked about, okay? And it goes back to disease of exotic animals, which is sort of the textbook version of my thesis for my postdoctoral fellowship, which represents 20,000 autopsies and 10 million chemistries and 10 million slides of special stains looking for pollution and all that kind of stuff. Those books, Disease of Exotic Animals, if you can get one used on Amazon used books for less than $2,000, you better get it. If they're beat up pretty bad, you might get one for $900 or $1,200, something like that. But usually they're like $1,900, $2,000 beat up. If they're in good condition used, you might get them for $8,000 to $12,000 each. If you get them brand new, still in the box, in a cellophane wrapper, $25,000 each. This thesis in hardcover called The Disease of Exotic Animals is in the Smithsonian Institute as a national treasure because it was the first time that anybody ever had looked at the diseases of 454 species in the same study. Usually when a doctor, medical doctor, veterinarian, or PhD, or a pharmacist, or somebody like that does a study on a disease, a pharmaceutical, a nutrient, at the end of the study, they, kill off the animals, or if they die during the study, they might do 50 autopsies during a 5-year period on rats, or dogs, or hamsters, or rabbits, or something like that. But nobody's ever done 20,000 autopsies on 454 species of animals and human beings, okay? And so 17,000 some change, 454 species, and 3,000 humans. And basically what I learned was that every vertebrate, including humans, whether you're a flamingo or a porpoise, a fish or a turtle, a human being, a flamingo, rat, rabbit, pig, dog, cat, if you get the same deficiency, you get the same disease. There are no genetically transmitted diseases. I mean, this was a huge finding. That's why my thesis is in the Smithsonian Institute as a national treasure. It's in the Smithsonian Institute as a national treasure. Okay, that's the one that's selling for $25,000 each when they're still new in the box. Now, the reason why I'm bringing that up is because in the 1960s, I'm finding hypoglycemia, type 2 diabetes, that sort of stuff, in alligators and crocodiles and all kinds of other vertebrate animals, including porpoises and so on. Dogs and cats. And, everybody just sort of dismisses it, and it's a genetic disease. No. It's a simple nutritional deficiency of a single nutrient, and I have been exonerated, if you will. I suppose that's the word I'm looking for. I have been exonerated just a couple of weeks ago in Lancet, which is the British version of the Journal of the American Medical Association. That's the British version. Okay, it should be called the Journal of the British Medical Association, but they call it Lancet, which is the British term for a scalpel. Okay, and they said watershed moment. Watershed, of course, means an enlightenment. Okay, watershed moment for type 2 diabetes. Understanding and management. As study confirms, disease is reversible. Well, I've been saying that since the 1960s, and everybody says I'm a nut. Okay? Well, I've been saying it since the 60s. Not only have we been saying it, but we have a program we call the Healthy Blood Sugar Pack, which we give 1 per 100 pounds of body weight. And if you only weigh 80, 90, 110, 120 pounds, you take that one healthy blood sugar pack per month, but you add an extra bottle of the secret sauce, okay, which we call Sweeties. Take 3 of those twice a day for that person weighing less than 150 pounds, plus a half a dose of everything else twice a day. Get away from all the bad foods, fried foods, processed meats, oils, gluten, wheat, barley, rye, and oats to maximize efficient absorption. Stay away from sugars, natural and processed. And I've had people who were really serious, brittle diabetics on multiple medications for 30 years, and in 30 days their doctor takes them off all their medications and says, I don't know why, but you're not a diabetic anymore. We do this thousands of times a month around the world. Okay? We are in over 50 countries. We have warehouses and offices and clinics in over 23. Okay? And that's because the world is realizing, and that's why I've spoken in the United Nations twice, that we can regrow cartilage when you have bone-to-bone arthritis. You don't need double knee replacement or double hip replacement. Okay? We can prevent and reverse Alzheimer's disease. This is simple nutritional deficiencies created by misinformation from the medical profession. Didn't exist 48 years ago, even by another name. Say physician-caused disease, Alzheimer's disease. There's a double-blind study, a 10-year study between 1994, after my paper came out on Alzheimer's disease, by a big university. Their results came out in 2004, and it was a big double-blind study. They said, the people who got the supplement program of Wallach, me, had 78% less Alzheimer's disease at the end of the 10-year study than the ones who didn't get the, they were the control group. The ones who got the supplements had 78% less Alzheimer's disease than the ones who didn't get the supplement. Are we kidding? No. Truth, published in medical journals. But nobody pays attention to this because their doctor says, that's all nonsense. You enable the doctor to continue treating you for diseases that are reversible. Contact your Youngevity associate and ask for epigenetics. Ask for dead doctors don't lie. Ask for rare earth-been cures. And let's prevent and reverse these pre-existing conditions. We'll be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us toll-free, 888-379-2552 on the priority line, 831-685-1080. Aromatherapy oils have been prized by ancient cultures for thousands of years. Youngevity's ancient legacy, true aromatherapy, is no exception. Essential oils are the fragrant life essence from plants that are gently removed through the process of steam distillation. Youngevity's ancient legacy essential oils are of the purest concentrations from the most respected and ethical distillers worldwide. Many ancient legacy oils come directly from families in the East which have been distilling essential oils for over 100 years. Keep Ancient Legacy's tea tree oil in your medicine chest for first aid. Tea tree oil is great for soothing the itching and stinging associated with insect bites, burns, scrapes, and other skin irritations. It's also effective as an antiseptic. To learn more about aromatherapy and essential oils, contact your local Youngevity associate today. And don't forget to ask about business opportunities.
Hello, Judy DeVilbus here. If I could only afford to get one product out of everything, that product would be the Ultimate Classic. It has the vitamins, the minerals, the bioflavonoids. It even has grapeseed extract. The one product that would give you just about everything under the sun you would need for a perfect nutritional program would be the Ultimate Classic. By the way, people that are on the go, it's very, very hard to take the liquids with them when they go on their trip to get their supplements in every day. Well, you know something? You can use the Ultimate Daily Tablets and the Mineral Capsules. When I'm going on a trip, if I have enough room, I just take the 2 bottles with me. If not, just use a little baggie and take a couple of daily doses with you. It's very simple. It's very easy. There's no mess, no fuss, no refrigeration. Just take your capsules, take your tablets, and you're finished for the day.
To order these products, call your local Youngevity distributor today.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're going to do the longevity business as a business, I urge you to contact your longevity associate and ask for that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. That's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, Passport to Aromatherapy. And don't forget Wall Street for Kids. Learn how to be profitable. Learn how to get the tax breaks of billionaires for a one-time fee. A one-time fee at $25. Remember, Costco and Sam's Club, you got to re-up every year. You got to pay the membership fee every year. Ours is a one-time fee of $25, which is tax deductible, and it's a willable asset. You get the same tax breaks that billionaires get. You'll get back most of or all of your withholdings, which are taken out of your paycheck by your company you work for, if you're seriously working your longevity business. Okay. Doug, what pearls of wisdom do you have for us?
Well, you've been vindicated again. As long as I've known you, you've been an advocate of women breastfeeding their babies. And I've got a story here from Natural News headline, Breast Milk, the gift that keeps on giving. Babies who are exclusively breastfed have less than half the risk of eczema as teenagers than those who were not. You see, adding to the wealth of evidence that prove benefits of breast milk, new study finds that breastfeeding lowers the risk of eczema in children by half. And this comes from the College London, Harvard University, and University of Bristol and McGill University. The researchers there assessed whether a prolonged exclusive breastfeeding lowered the risk of asthma, atopic eczema, and low lung function in adolescents. This was published in the Journal of American Medical Association. They analyzed data from a total of 13,557 teenagers aged 16 from Belarus, all who were enrolled in the Promotion of Breastfeeding Intervention Trial, or PROBIT. A study initially recruited 17,000-plus mothers and their newborn babies from June of 1996 to December of 1997. And they studied 31 maternity hospitals and one outpatient clinic associated to each hospital. Participating institutions were randomly assigned to either take part in the breastfeeding program or not, and breastfeeding programs train nurses, midwives, and doctors to promote and support mothers to breastfeed their babies. They followed up the babies until they were reached adolescence and determined whether the effects supported breastfeeding supported their lung function, asthma, or eczema. Participants answered surveys on three health issues. In addition, the researchers conducted a skin examination for eczema and breath examination for lung health. And the largest randomized trial ever carried out in the area of human lactation continues to yield scientifically, clinically important information more than 2 decades after inception. And they said a study revealed that the children whose mothers received support to breastfeed exclusively for a sustained time from birth had a 54% lower risk of eczema at age 16. World Health Organization recommends between 4 to 6 months of exclusive breastfeeding and to aid prevention of allergy and associated illnesses. They say breastfeeding does not only benefit the babies but also the mothers. The study revealed that women who breastfed for longer will continuously become more attentive mothers up to 10 years. So there you go, breastfeed to win.
Oh, absolutely. And, of course, there was a big study done in India comparing SID, sudden infant death syndrome, in babies that were breastfed versus babies who ate formula. Guess which ones had the highest rate of SID, sudden infant death syndrome? Formula-fed or breastfed? Formula-fed. Yeah, absolutely. And that's because, of course, SID, sudden infant death syndrome, or crib death, is not due to babies getting tangled in the blankets or sleeping on their stomach and suffocating to death, or not sleeping in a cardboard box like they do in Finland. They actually die of a deficiency of a single nutrient. And, of course, the mother would die of a sudden heart attack if they're missing that same nutrient. And so the mothers have these nutrients in them because they're eating a wide variety of foods, and that's coming through the breast milk. Babies that are being fed infant formulas they only have like anywhere from 5 minerals in total of, when you look at all the other nutrients, we're looking at 18 to 20 nutrients as opposed to 90, not even a third. Breast milk is always better, but still mama needs to be on the 90 cents of nutrients, and that'll all come through the breast milk into the baby. That doesn't even make it better. It's making a good thing better, making a great thing better. Thank you, Doug. Super job as usual. And we'll be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us toll-free, 888-379-2552. Imagine a rich, decadent chocolate that's actually good for you. Youngevity's Triple Treat chocolate is just that, an antioxidant-rich dark chocolate complete with probiotics to aid in proper digestion. This all-natural product contains no preservatives, and for those with dietary restrictions, it's gluten-free, dairy-free, glycemic-friendly, and kosher certified. Not only does Triple Treat dark chocolate taste fantastic, it contains super antioxidant blueberries to absorb free radicals with an ORAC value of 16,936 per piece. Triple Treat chocolate also contains a proprietary blend of probiotics with over 500 million live healthy bacteria per 8 grams at the time of manufacture, with 80% reaching the intestines, which is much more than most live culture yogurts. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. Pure Works to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. Pure Work disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of Pure Works on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on Pure Works and get Pure Works on your hands. Stand by. Pull out your paper and pencil for your local number to order Pure Works.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 95 Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you need to lose that 10, 25, 50, 75, 100 pounds or more, contact your Youngevity associate and ask for that book, Hell's Kitchen. There's actually a great CD that goes along with it, Hell's Kitchen. The subtitle is The Cause, Prevention, and Cure of Obesity. We know that. The nutrients that are necessary to prevent and reverse obesity are no longer found in optimal amounts in our food. In some places, they're not even in there at all. You have to supplement, right? And then, of course, we have the book Energy Crisis, which goes into the keto diet. We actually have a keto caramel shake and a keto caramel meal bar, which I just ate for lunch here. And it gives you the right ratios of good fats and good proteins and almost zero carbs, which is going to help the supplement program help you lose weight, 1/2 pound, 2 pounds a day. Okay? You'll never gain the weight back. as long as you stay under 90, because being overweight and obese is not due to lack of exercise or eating too much. It's actually due to a nutritional deficiency of any one of the members of this special nutrition group. Also, let's see here. There's 3 of those nutrients. If you're deficient in any one of those, you're going to be the 300, 500, 800-pound person. Okay, Doug, let's go to callers.
Let's head to California, and Madru, you're on with Dr. Wallach.
Hello, Madru, you're on the air.
Hi, Dr. Wallach.
Hi.
I have a gentleman. He is 5'8". He's 175. He has a cataract, he says, because he got hit in the eye. Thinks he has a cataract. Well, he's been told he has a cataract because he got hit in the eye some time ago. And he has a hernia in the belly area, which his stomach, 1 minute is flat, next minute it's big.
Mm-hmm. Okay, any other issues? Any high blood pressure, diabetes, arthritis?
No.
Okay, well, at 5'8", 175 pounds, that's about right. So the cataract may or may not have anything to do with trauma. Usually cataracts are caused by free radical damage to the very sensitive proteins in the lens. And, of course, when you have a hernia, that could be a birth defect, and he had a teeny tiny one when he was born, and it just got bigger and bigger over time if he's got a belly on him. Or it could be because of a breakdown of the elastic fibers in the tendons and ligaments holding the 2 sides of the belly together. There's muscles running up and down the right side, muscles running up and down the left side, and they're held together by a tendon. It's called the linea alba that holds everything together. And when that gets a little hole in it, stuff, fat, intestines come out through there, and you see this bulge under the skin. Okay, so Charmaine, are you there?
I'm here.
Okay, dear. Now, what would you do for this guy to get rid of all the inflammatory stuff and get him on something that's going to support maintenance repair of musculoskeletal stuff?
Well, I would get him on gluten-free
175
diet.
pounds.
Yeah, I'd get him on a gluten-free diet, and then he needs I'd get him 2 healthy bone and joint packs, I guess.
Perfect.
Right?
Yes, you get an A++. Very good. And what would you do to really give him some more stuff to work on that connective tissue?
Besides glucogel,
the
I
two
give him
healthy...
that glucogenics, right?
No, I'd give him the liquid glucogel.
Oh, liquid glucogel. Okay.
Yeah, okay. Yeah, I'd have him take 2 ounces a day, so it'll be 2 quarts a month of the liquid glucogel. And then he needs to wear a truss, a pad on his belly button to hold things in when he's vertical. But at night, he needs to put a 2x4 under the feet of the bed, so everything is pulled away from his belly towards his diaphragm. And that way, it'll take the pressure off that for 6 or 8 hours while he's sleeping. And then give us a call every couple of weeks. Let us know how he's doing. We'll be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. That does open a line. If you'd like to talk to Dr. Wallach today, call us toll-free, 888-379-2552. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Longevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there, in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Longevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Longevity distributor today. And don't forget to ask about Longevity home-based business opportunities.
This is the ZBS Radio Network.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity 95 Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you want to live to be well beyond 100 chronologically, say 110, 120, 130, 140, 150, 160, 170, 180, 190, 200 plus, while being biologically 30, 40, 50, contact your Longevity associate. As for the books, Epigenetics, The Death of the Genetic Theory of Disease Transmission, the book Immortality, which goes into the top 20 longevity cultures according to the National Geographic, you know, the Blue Zones kind of guys. And also, they'll show you why they have 40 times 100-year-olds we do. They have 40 times 100-year-olds we Americans do, right? They have 100-year-old per 250 of their population. We only have 1 per 10,000. What are their secrets? And then, of course, the book Rare Earths and Cures goes into great details of most of the diseases you'll get from mineral deficiencies primarily, which are the things that the deficiencies keep you from attaining your maximum genetic potential for age and longevity. Okay, Doug, let's go to callers.
All right, let's head to San Jose, California. And Robin, you're on with Dr. Wallach.
Hello, Robin, you're on the air.
Hi, Dr. Wallach. How are you?
Hi.
Thank you for all you do for humans and animals.
Well, thank you. How can we help you, dear?
I'm calling for a gal who's been on the nutrients for about 2 years. She's 79 years old, and she has this most interesting condition in her eye, which is called the bleb, B as in boy, L-E, B as in boy, bleb, and it grows over her cornea. And she has a history of glaucoma, and her mother has that. And we're just looking to see if there's anything that can be done for her.
Okay, now this bleb, is it like a bubble on the cornea, a bubble protruding out?
I wish I had her on the call. I don't know. All I know is it's a growth that grows over the cornea. It's been surgically removed, and it continues to grow back.
Yeah, okay. This can also be called keratoconus, K-E-R-A-T-O, conus, C-O-N-E-U-S. And keratoconus is actually a deficiency of a single vitamin, okay? And people like her would also have skin problems. Do you know if she has any skin problems?
She does have some skin problems. I have her whole health evaluation here. Yes, she does have some skin problems.
Does she have dry skin or rough skin on the back of her arms and thighs, or does she have eczema, dermatitis? What has she got?
She just has some dryness.
Mm-hmm. Okay. And how much does she weigh, you think?
I have her. It's 210 pounds. She's been losing weight. She's 5 foot 6.5 according to this evaluation. It's
you know, she's, for a lady, she's at least 40, 50 pounds overweight right now, right?
Yes.
And so, also, does she have any things like diabetes, high blood pressure, arthritis, anything like that?
She has glaucoma, high cholesterol, fibromyalgia, and one other thing.
And when you say high cholesterol, do you know what the numbers are?
I don't.
Okay, yeah, because usually their medical doctors' high numbers are too low, is what they are. Okay, so Charmaine.
Yes.
What do you think Robin's friend is going through here? She's got keratoconus, this bleb thing on the cornea of the eye, which you remove it, is going to keep coming back because they haven't solved the problem with surgery. She's 40, 50 pounds overweight. She got glaucoma, which is kind of pressure inside the eye. And then she got fibromyalgia, which is kind of like a lupus, sarcoidosis kind of thing. Muscles, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, they're all manifesting negative changes here. What do you think is the basic underlying problem here?
She's definitely got a gluten intolerance.
Yes, ma'am. You get an A+. Yeah, she's got a gluten problem here. And so what would you do for her, 210 pounds?
Wow. For those issues, I would get her on... I guess I would.
We got to run to one. We got to run to one of those message moments. So hang on, dear. Get yourself collected and organized, so we can just blab it out when we come back after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. If you'd like to talk to Dr. Wallach, call us on the priority line, 831-685-1080, toll free, 888-379-2552. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. 3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it, too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity, 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you're a little nervous about just getting in there and dealing with 900 different diseases, even with the reference books, Let's Play Doctor, Let's Play Herbal Doctor, Passport Aromatherapy, say, I just don't have any chemistry background. I don't have any idea what nutrition is other than burgers at a fast food place. I really need more, some basic information. Well, you want to contact your Youngevity associate and get a hold of the bundle, we call it. It's a book and a CD and a DVD called the Truth About Nutrition. The Truth About Nutrition. It's actually put together by Jimmy Osmond of the famous Osmond family on TV. He followed me for 2 years, filmed and recorded my presentations, interviewed me in the studio for 6 or 8 hours, and put together this bundle, The Truth About Nutrition, the book, the DVD, and the CD. Contact your young deputy associate and get this basic information. That'll get you started. Okay, Doug, let's go right back to California. And Robin, okay, Charmaine.
Yeah.
Her friend, 79 years old, again, 210 pounds, she's 5'6". I'd like to see her weigh 145, 150. She's got glaucoma, pressure in the eye. She's got fibromyalgia, and she's got this bleb, a.k.a. keratoconus, on the eye.
Okay. For those issues, what I would give her is 2 healthy brain and heart packs because of the eye, and I would give her the Occutive, and I would also give her vitamin D3, and also the Ultimate Daily Classic for...
Very good choice, yeah, for the glaucoma, which is pressure in the eye.
Right.
Mm-hmm. And let's see here. What else would you give for the fibromyalgia?
Glucogel.
Yep, I would throw in the glucogel.
Okay.
15 a day, 5, 5, and 5. Also, you want to get some collagen in there. Extra collagen. How would you get that in there?
I don't know.
What do you mean you don't know?
Extra collagen?
Yeah.
Collagen, HGH?
No.
What?
No. You're going to talk about the liquid glucogel.
Oh, okay.
Liquid glucogel. It's collagen.
Doesn't the regular glucogel have
Yes,
it?
but she needs more because she's got fibromyalgia.
Oh, okay.
I'd have her
That's
take
a trick question.
210 pounds. I'd have her take 2 quarts a month. She can take an ounce of that with breakfast with her supplements and an ounce at dinner time with her supplements. And vitamin D3, 2 bottles a month, throw that in. And you were quite correct on the Ultimate Daily Classic tablets, 2 bottles of that, so you can take 3 of those twice a day. Support healthy blood pressure, healthy pressure in the eye, and healthy blood flow through blocked arteries. What would you do to help her lose a half a pound to 2 pounds a day?
Rev, of course.
Rev. Good girl. Yep. Get the 1 bottle of Rev per month. Put a dropper full under her tongue, if you would, Robin, and let her absorb it through her oral tissues. And within a couple of days, she'll start losing a half a pound to 2 pounds a day. And she'll never regain the weight as long as she stays on the 90 appropriate for her final chosen weight. Okay? And when it comes to the drops and the glaucoma, once every couple of weeks she should run to the doctor, eye doctor, and let them take the pressure in her eye and see how much they can reduce the number of drops she takes to maintain the pressure in her eye. Okay, Doug, let's go to callers.
Let's head to Orlando, Florida. And David, you're on with Dr. Wallach.
Hello, David, you're on the air.
Hi, Mr. Wallach. Thanks for taking my call.
Mm-hmm. How can we help you?
I have a 2 question. The first question is, I'm getting bald, my hair getting thin right in the center of the skull. And over the year, when I'm thinking that the hair were too thin, sometimes I put an oil on and they come in my hand, few hairs. And that
okay, how much do you weigh? Stop. David, how much do you weigh?
170.
Okay, and how tall are you?
5'10".
5'10"?
5'10".
And do you have any other issues? Any high blood pressure, diabetes, arthritis? Eczema? Do you have any skin problems? You have back problem?
Yeah, back problem. I have the little hump in the back, and they diagnosed me with arthritis.
Okay, very good. And let's see here. You weigh 170. Okay, Charmaine, what would you do for this guy? He's got some arthritis and some osteoporosis, and as a result, he's got kind of a male version of the Dowager's hump, kind of bent over. Weighs 170 pounds. He's losing his hair. And so what would you give this guy? What kind of diet and what would you supplement him with?
Well, he should be on a gluten-free diet. Everybody should be. And, don't burn animal fat, no oils of any kind. And for those issues, I would give him 2 healthy bone and joint packs.
Okay, 2 healthy bone and joint packs, a full dose of everything twice a day. What would you do for sunshine?
Vitamin D3.
Vitamin D3, 2 bottles a month, 3 of those capsules at breakfast and dinner time. And I would go also, what product would you give him for maybe helping the scalp be healthier and happier?
Well, you could try the hair, skin, and nails and see.
Yep, I'd get him 2 bottles of hair, skin, and nails per month, so you can take 3 of those capsules twice a day. You're exactly right. And there's a couple of minerals. The Japanese did big studies, which are in the book Rare Earths and Cures in Chapter 11, on male pattern baldness in both males and females. And there's one nutrient that's missing, and it's a mineral, And so how would you give him extra minerals, either as a capsule or as a liquid?
Yeah, the liquid minerals, either the liquid minerals or the mineral caps.
Yeah, 1 mineral cap is equal to 1 ounce of the liquid, and so he needs, say, 2 extra quarts of the liquid minerals, okay, to where he can take an extra ounce at breakfast and dinner, or if he wants less liquid, he could take 2 bottles a month of the capsules, and he could take 1 capsule at breakfast, 1 capsule at dinner time, which is what I do because I travel so much. I take the extra minerals for that nutrient as well as many, many others. And then what's your second question here?
Massaging oil all over your body, like in the Ayurvedic treatment they do, like massage your body with the oil. Is that a healthy alternative or no? Because you said no oils, no cooking oils.
Yes,
so
no oils, absolutely, because they turn into trans fats, heterocyclamines, acrylamides, all of which are very, 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 very irritating, very, very, what's the word I'm looking for, Shar? Inflammatory. Yeah, inflammatory. Okay, and it's going to cause problems. Even when you put it on the skin, it causes problems in the arteries and increases the risk of cancer and all that kind of stuff. And so applying oil to the scalp is not, over the long term, is not a good idea because, again, of the free radicals, trans fats, the inflammatory stuff, too many bad things. And, of course, again, you got to be gluten-free to increase the absorption efficiency of those nutrients so the scalp gets more nutrients. And we've had people who are completely bald like an egg for 40 years, and after a couple of years on this program, their hair began to grow back, okay? So, and we have many, many, many with not quite so exciting, but good stories, where they didn't get a complete restoration of hair, but they got maybe 50% of their hair came back kind of thing, and just by supplementing. And I'd go that direction and stay away from the inflammatory stuff, see if you can increase the efficiency. Okay? All right. Let's see here. How much time we got, Doug?
We got about a minute before we roll the music.
Minute before we go to a break. Okay. Char? Charmaine?
I'm here, yeah.
Well, I didn't hear you.
I said yes.
Oh, I didn't hear you. Okay. So I want to know, if you were going to give a beginner, somebody who just really, really wants to help other people using the longevity system, but really is a beginner, in addition to the Truth About Nutrition, what book would you get them? What book would you have them buy? What CD would you have them get to really get them on the right path so they understand what the heck is going on here?
Well, personally, I would get the Doctors Don't Lie CD because that's kind of 101. It kind of goes over everything.
Yep. And and the book would be the same. I would go that direction. Dead Doctors Don't Lie is still, when people order books, they'll order 5 different books. They always include Dead Doctors Don't Lie. They order 10 CDs. They always include 5 of those 10 are Dead Doctors Don't Lie, because that's the message that people need to get out and get people thinking about what they can do to deal with preventing and reversing these pre-existing conditions, which are really just nutritional deficiencies. Okay, well, hang on, folks. We're going to be back with Dead Doctors Don't Lie after these messages.
You're listening to Dead Doctors Don't Lie on the ZBS Radio Network with your host, Dr. Joel Wallach. Many believe that all life began in the Earth's oceans. We do know that the oceans and seas are still abundant with life and life-sustaining nutrients. Many cultures have long believed in the life-giving properties of plants and sea life harvested from the oceans. Longevity's Ocean's Gold is a proprietary blend of seaweeds, algae, mosses, kelp, sea cucumbers, and sea minerals, as well as coenzyme Q10, calcium, and iron, all designed to help support healthy thyroid function, regular heartbeat, normal weight, mood stabilization, and hormone levels. Take advantage of life-sustaining nutrients from the Earth's oceans with Longevity's Ocean's Gold. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine-tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I got to tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local longevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and longevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Longevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. And Doug, let's go to callers.
Let's head to Tucson, Arizona. And Joy, you're on with Dr. Wallach.
Well, Joy, you're on the air.
Hi, Dr. Wallach.
Hi.
I'm a fairly new distributor. I'm very excited.
Welcome to the family.
Your products. I'm really anxious to learn everything that I can.
Okay.
Today, I have a dear friend who is a 3-time cancer survivor. She's battling squamous cell carcinoma, but it's inside in her esophagus lung area.
Mm-hmm.
She's about 5'7", 130 pounds, and I was wondering if do you have any advice that you could give me for her? She's had surgery and radiation. She went into remission, but it has now returned.
Sure. Okay. Well, your best friend when you have any type of cancer is your own immune system. Okay? Chemotherapy kills cancer cells, but it also kills normal cells. Radiation kills cancer cells, but it also kills normal cells. So those are always the problem. Okay? She weighs 130 pounds, you say. Charmaine, you there?
I'm here, yes.
What would you do to help Joy's friend? She has squamous cell carcinoma inside in her esophagus and maybe other places. She's been in remission a time or two, but it persists, okay? So what are we going to do to help her immune system, to help her fight this cancer as best we can? At the minimum, we'll be able to give her a better quality of life and add some time. If they said, she's got 6 months to live or a year to live, those kind of things, oftentimes we can extend that. Certainly, their quality of life would be much better than if she gets, one more round of chemotherapy. Okay, but she has her choice. She could do both. She could do chemotherapy and radiation and our stuff. She could do our stuff alone, or she could do chemotherapy and radiation alone. That's ultimately her choice. So what would you suggest to support her immune system with diet and also a supplement program?
Well, first of all, I would get on a gluten-free diet, and then I would have no oils of any kind, no burnt animal fat, no fried foods, of course.
No processed meats.
No processed meat because nitrates cause cancer.
Cause cancer, yep.
Exactly. And then for a supplement program, I would get her on a brain and heart pack, and I would add to that the Ultimate Daily 2.0 tablets, tangerine tablets, and I would add the Z-Radical And if she can afford it, the Fucoid Z also, and the Ocean's Gold, and I would take the Oxybody if it was me. And,
okay, so let's stop there.
Okay.
Stop there. And the Ocean's Gold, why would she take a thyroid product for her immune system?
Because it's got sea cucumber in it, which is very notorious for dealing with those.
Yeah, supporting your immune system when you have cancer. I mean, it's been the studies on sea cucumber and cancer have been written up in the New York Times, and I mean, it's just really exciting for everybody. So, at 130 pounds, as you say, one healthy brain and heart pack per month, get an extra bottle of selenium, so you can take 6 of those a day. Everything else, cut it in half, take a half a dose twice a day. She also needs the Z Radical. I'd have her get 2 quarts a month there, ounce at breakfast, ounce at dinner time. The Z Radical, she could take 3 of those capsules twice a day. That's 2 bottles a month, 3 capsules twice a day. The BTT 2.0 tablets, get 1 bottle a month. She can take 2 of those at breakfast, 2 at dinner time. That's going to give her 160,000 ORAC points per day, plus what is in the other stuff. And let's see here. Oh, yeah, the Ocean's Gold. She could take 3 of those twice a day. That's 2 bottles a month because of the sea cucumber that's in it, and also the Oxybody, because alternative experts and people who have been doing this much longer than I'm my age say that cancer doesn't like oxygen, and oxygen supports your immune system and your body's ability to heal itself. And so Char is exactly right. Personally, I would definitely take the Oxybody, an ounce, say, before each meal, so 2 to 3 quarts a day, whatever is comfortable financially. But when you have a serious life-threatening situation, it's best to give up other things and maximize what you can do so that you're going to get the best result. You look at Senator, let's see here, John, what's his name? McCabe. Yeah, John McCabe, senator from Arizona, has a brain cancer. I guarantee you they're just giving him surgery and chemotherapy. And he's in the hospital very, very ill right now, not doing well because of the side effects of the treatment. But at any rate, give us a call every once in a while if you would, Joy, and let us know how this person is doing. And again, welcome to the Youngevity family. We're looking for people like yourself who are really proactive. Thank you so much, Char. Super job as usual. Thank you, Doug and Sam. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. God bless our American flag. God bless our national anthem. And God bless America.